is not very surprising when we get into what actually impacts sleep. So I feel a bit awkward being called an expert, but I suppose I've talked a lot about sleep at this point and read a lot about sleep, so I'm happy to play that role today. But if I say anything that doesn't make sense or just you feel like it needs a bit more elaboration, just please do feel free to give a wave or put something in the chat, or both if I don't seem to notice. I'll try and keep my eye on everybody's windows and the chat as well. All right, and so basically what I'll do first is just give a really brief talk about the different stages of sleep, because I think that's really important to sort of understand what's actually impacted when sleep becomes either less people getting less quantity of sleep or less quality of sleep, because they're two different issues that can occur. And then we'll go over some of the common sleep problems that come up, especially in the context of cancer. And then I'll give a really brief sort of whirlwind tour of what you can do to improve sleep. Now, keep in mind that the people at Peter Mac in the psychology department spent a huge research project putting together and then testing a sort of self-help sleep improvement booklet. And a lot of the stuff that I'll talk about will come from that approach, which is a cognitive behavioral approach to sleep issues. And so, sometimes people in these sorts of sessions take notes and stuff. If you're feeling a little bit like you want sort of the information written down, you can go and get that booklet for free. It's on the Peter Mac website. And if you look for Can Sleep Peter Mac in Google, you should find that PDF, or we could send it to you if you ask for it as well. So really quickly, we know that there are, roughly speaking, 4 stages of sleep, and everybody goes through all of these different stages in a cycle that repeats across the night. And so the first stage is this light drowsy sleep, when you're sort of on the edge, we feel on the edge of falling asleep. After people have sort of been in that stage for a little while uninterrupted, then they will enter stage 2, where their body temperature and heart rate drops. And if they can go from stage 2 into a deep sleep, they'll spend a good chunk of the night in a deep restorative sleep. And that's stage 3 or 4 of deep and restorative sleep. That's where people actually feel refreshed. They feel like their body has healed from the challenges of the day, and they also get sort of a mental refreshment as well. All of that good stuff that we associate with sleep is happening in that deep or restorative phase. And then what happens after that is people go into rapid eye movement sleep, which is when we have dreams. The whole cycle takes about an hour and a half to 2 hours, and then people will go back to the start again. So they'll go from stage 1 down to 2, then 3, 4, then REM sleep, and then back to light drowsy sleep. And the really interesting thing about that is that most people, when they get back to that light or drowsy sleep, do wake up. Nearly everybody wakes up many times at night, usually between, I think the average is something like 9 to 12 times. Everybody will wake up throughout the night. And so the issue is when people have problems feeling like they're waking up a lot in the middle of the night and getting distressed by that, usually the issue isn't that they've woken up in the first place, it's that they haven't been able to just sort of roll over and go back to sleep. And most of the time people won't even remember that they've woken up, because it's just been a minute or so, and then they've sort of rolled over and gone back into that light drowsy sleep. So when people are talking about a lack of sleep, what they're usually talking about is a lack of these deep sleep stages, deep sleep and REM sleep, where we get the real benefits of sleep. And deep sleep is the one in particular that will actually decrease our sleep drive. So if you think of a need for sleep as like a hunger, in the same way that we have a hunger for food, we have like a hunger for sleep. It's only that deep sleep stage that will sort of satiate that drive. And typically what happens is that even though we go through those cycles, we do spend more time in REM sleep within that cycle as the night goes on. But the other interesting thing about all of these cycles is that they actually seem to adapt when people lose sleep. So in other words, if you wake somebody up um, before they get to deep sleep night after night, over time their body will actually compensate for that, and they'll spend more time of that sleep cycle in the deep sleep state when you eventually let them have a proper night's sleep. So our body's actually pretty good at compensating for whatever stage of that cycle we've missed out on. Um, so there are a lot of factors that seem to change people's experiences with sleep. First one is age. Everyone who's had a baby will know that they, don't have these sort of neat nighttime sleeping schedules that we do. They sleep pretty much all the time, and then they wake up, and then slowly that window of being awake and the window of being asleep starts to get regulated. And then as people get older, quality of sleep seems to be deteriorating. There are also lots of individual differences, though, which can probably be accounted for partly genetically, and then people also learn different sleep patterns as well. Physical activity really helps people get better sleep because it builds up that sleep drive we were talking about before, and it means that they will naturally then feel tired, and also their body will naturally give them more time in deep sleep. And then the opposite is true of physical illness, where people can often either feel really, really drowsy all the time, or they can just feel that they can't actually sleep properly because of physical illness. And as we'll talk about later, that's pretty much because a lot of the time those different early stages of sleep are getting interrupted by the symptoms of the physical illness. And then we also know that stress and mental health problems impact sleep as well for lots of reasons, particularly things like anxiety, where people's thoughts are really fast and really negative. People can get distressed by that, and that has an impact on their body's ability to sort of calm down and get ready into a deep sleep. So we have this sleep drive, and that's probably the biggest factor that determines sleep. The sleep drive is, you can just think of it like a drive like hunger. And ideally, we spend the day kind of building up our sleep drive. And then when we get to the evening, we naturally have this window where it sort of tips over a certain point, and we actually feel sort of tired and like we would like to go to bed. And the two things that sort of really then disrupt that sleep drive is, one, if people nap during the daytime enough that they actually spend time in deep sleep, they're going to be satiating that sleep drive, and it won't have as much of an impact later at night. In the same way that if you are sort of snacking throughout the day, you won't have the same kind of hunger for a big meal. And then the other thing that seems to really impact that whole sleep drive impact is that if people kind of miss that window of sleepiness in the evening, that idea of having a second wind really seems to be the case. And so it can be, sleep drives are a really interesting thing, and it can be really helpful just to sort of pay attention to it in the evening. The other factors that determine our sleep cycle is the circadian rhythm. So all creatures on Earth have some type of circadian rhythm that regulates their pattern of sleeping and waking across the 24-hour period. And we have roughly 8 hours of sleep, 8 to 12 hours of sleeping, and then the rest of the time awake. And you can think of it like an internal body clock. The interesting thing about that is that we have all these sorts of cues that actually start to impact that body clock. The biggest one being exposure to light. And so when we actually have a bright light source into our eyes, that's actually having an effect on the part of our brain that manages circadian rhythms. And so this is why sometimes when people have really severe sleep issues, they'll do light therapy. But a really sort of casual way of doing light therapy is just to make sure that when you wake up in the morning, you're exposing yourself to bright light, ideally sunlight, first thing, and that will sort of start your body clock for the day. And then by the same token, you can manage that in the evening by sort of reducing exposure to light. And then the other thing is that our mental state really does seem to impact our sleep patterns. And one of the biggest things that we find, particularly when people are either patients or carers in the context of cancer, is that worrying and planning and those sorts of thoughts that really wake our body up can really impact our ability to fall asleep as well. Any questions so far? Just remember, I haven't seen anybody waving around, but in case I've missed it, let me know. Yeah, go for it, Bruce.
Just on that one, Oliver, third part, quiet mind, is it in that general area, those of us who have problems controlling pain will start to impact there, or do you have any comments you would like to make about pain and its impact on our sleep, please?
Yeah, absolutely. We'll get into this a little bit later, but pain absolutely is a huge disruptor of sleep. And I wouldn't say that it's the same thing as having a busy mind. I mean, pain hurts and it really can disrupt people from feeling relaxed enough to sort of go through those first two phases of sleep and into a deep sleep. Pain often just physically feels like it's waking your body up, you know. Um, but the overactive mind can be triggered by pain. So that's the tricky thing that I find as well. Pain tends to trigger all sorts of thoughts about, well, what the pain means, how the pain is going to impact sleep. And it's also a reminder of physical illness, which then has all of its own worries attached to it as well. So I think pain is a sort of physical disruptor to sleep, and then pain can trigger overthinking as well. Does that make sense to you?
Yes, certainly.
Mm.
I suppose quite particularly, but quickly in mine, is trying to find a position where I can lie in bed where I'm comfortable and relatively pain-free.
Mm.
So that leads to a lot of restlessness
Yeah. Yeah.
and hence rolling around in activity so I don't relax and let the sleep come over my body and mind.
Yeah. And when we talk about solutions, we'll come back to that sort of thing. But I think it's a really good point because some of the solutions that we need to keep in mind are really practical solutions about how to relax the body, and those do seem to have they can have a really profound impact on how intense pain feels. And then also some of the solutions are about the kinds of worrying and thinking that gets triggered by pain as well. So if you can sort of approach it from both of those directions, then you're doing yourself the most favors. It's a really good point. If I don't cover it enough, then we'll have lots of time at the end to come back to it. So just do remind me. This slide in particular is a good example of why I think this is such a popular topic and why it's really important for Peter Mac to have a really good program for sleep. You can see that about 10 to 15% of people in the general population have sleep difficulties, and then for people with cancer that at the very minimum seems to double, and on the upper ends gets to about 60%. There's this other study which focuses on carers as well and says that the impact of cancer for a carer is extremely significant as well. We have about 40% of patients and 42% of carers report sleep problems. They're associated with more pain, so there's a significant association there, and also with anxiety. And a lot of the time, not for everybody, but for a lot of people, when you actually then map out how long people are asleep, it looks similar to other people's sleep. So they're in bed for the same amount of time, and often they're actually asleep for the same amount of time, but the quality of sleep is really disrupted. And it seems to me that a lot of that is about how much time is able to be spent in deep sleep. We've got a lot of causes of sleep problems that are important to be aware of, because sometimes there are really straightforward things that can be relatively quick fixes. So, for example, a poor sleep routine is probably the biggest one. That can be really difficult to manage for some people just because they've got like really chaotic life commitments that they need to do. But often one of the best things you can do to start correcting sleep is to have a routine for when you wake up in the morning, same time each day. Diet and nutrition really impact sleep, particularly when people eat a lot right before they're trying to fall asleep, or when their diet's really full of sugars. Um, Caffeine, nicotine, and alcohol all really disrupt sleep. Sometimes I've spoken to people who've had sleep issues, and then, when we really look at their caffeine intake, they're having 8 cups of coffee a day or something like that. And, it's a sort of a go to thing to just look at, first of all, these straightforward solutions. If for anyone having nighttime sleep problems, I would probably recommend just to try to cut caffeine out entirely. And if that feels really impossible, it would be for me, to at least leave it to the first half of the day and try not to be having caffeine in the second half of the day. Um, Alcohol is a really tricky one because for a lot of people it feels like it helps them to fall asleep. But the quality of sleep when people have had alcohol seems to be a lot worse. And so um, there's a lot less of the restoration when people fall asleep after drinking, particularly drinking heavily. Um, Snoring, and I'd connect things like sleep apnea to this, can be disruptive. And if people are telling you that you are snoring really loudly or having sort of like really clear respiratory sounds throughout the night, might be worth considering that there could be sleep apnea there, or something that you might want to medically check out. Dreams and nightmares affect a lot of people, especially in the context of cancer. I speak to lots and lots of people who awake from nightmares, and the tricky thing about that is that they find it really hard to get back to sleep because the nightmare is really arousing for their body and their mind. It's either triggering a lot of worry, or it just makes them feel so restless physically that it's hard to get back to sleep. Um, and we can talk about how you might use some relaxation to help with that. Changes in body temperatures are a really tricky one, because lots of medications can have side effects that include things like feeling really cold or really hot, and having hot flushes and things like that. A lot of the people I speak to who deal with really significant changes in body temperature need to come up with some pretty creative solutions to that, like having different types of pajamas near the bed so that they can actually change in the night if they have to, without sort of waking up fully and looking for different things. Different types of blankets or doonas, again, so that they can just really easily respond to what they need in terms of body temperature throughout the night. Excess worry and mental arousal we've talked about, and I'll come to that again with some of the solutions for sleep a bit later on. Another thing that tends to really impact sleep is using a bedroom, and particularly the bed, for non-sleep activities. So this is something that we call stimulus control, or it's like an associated memory. But basically, we train our bodies to respond to certain environmental cues, and that can happen really quickly. I don't know if any of you known anyone in the army before, but one of the things that they do is they train people to be able to fall asleep, in any condition, and a lot of that is using these different environmental or mental cues. But what happens if you spend your bed, if you sit in your bed and do other activities, is that you actually train your body and your mind to sort of get into those same mental states when you're in bed. So in other words, if you worked all day in your bed, then your body is going to associate being in bed with getting ready to work. Same, unfortunately, if you're watching really exciting TV shows in bed, or reading really exciting things in bed, the more activities that you do in bed, the more you're sort of training yourself to associate your bed with these different physical and mental states. So one of the really good things you can do is to be aware of that and try and leave the bed for just sleeping. And then aside from all of those factors that impact everybody with sleep, cancer brings a huge amount of extra challenges, either in intensifying all of those things we've already talked about, or a whole new kettle of fish on top of them, especially the side effects of treatment or the symptoms of the illness itself. Um, Not to mention the fact that the diagnosis of cancer is a really distressing thing and has a lot of impact on people's future. It's something that people then find themselves worrying about a lot, or trying to plan for lots of different potential outcomes. It's really not a surprise that such a big life change would affect sleep. Hospitalisation can also really impact sleep issues, and a lot of the people who were referred to me to work on sleep have just come out of a stay in hospital where all of the routines and all of the environmental cues are totally turned on their head. They're sharing a ward with somebody else or having people check on them at all different times of the night. And then the other thing that can be really tricky with cancer-related sleep problems is that the worrying can take a sort of really heavy turn when people believe that the lack of sleep is going to impact their recovery from cancer, or it's going to impact the usefulness of the treatment. And so these sorts of beliefs can have a bit of a negative spiral for people, because when they're not sleeping, they might worry that the lack of sleep's going to make the cancer a lot worse. And that worry stops them from falling asleep, and we just sort of go around and around in this awful spiral. And so we can challenge some of those beliefs. They're often, and a lot of people I speak to, really understandable that people would sort of have those beliefs, especially based on a lot of the information that gets spread around. But they're also often extremely exaggerated. And so I hope I can relieve a few people with some of the by busting a few of those beliefs. We often talk about a difficulty with falling asleep as a different thing than staying asleep. There's also waking up really early, or feeling really, really sleepy in the middle of the day. Look, all of these different symptoms are pretty much, I would take the same approach to just trying to resolve nighttime insomnia. And most of these issues, you'd be considering the same sorts of solutions. The only thing that I would sort of really lean on is whether it's a chronic thing or whether it's something that's just come up in the context of cancer and treatment. If it's really chronic, it might be worth checking out whether there are those other respiratory issues, like sleep apnea and that sort of thing, that you just want to sort of cross off to make sure they're not what's causing the issue. So sleep disruption's really, really, really natural. I mean, most people have sleep issues at multiple times in their life. It would be pretty unusual for someone to go their whole life and not have sleep insomnia at some point. I think that when people are diagnosed with cancer, or someone they love is diagnosed with cancer, or they're caring for somebody in that situation, it's really understandable that they'd have nighttime sleep problems. A lot of the time their whole world's been turned upside down and they're worrying about all sorts of things. And I think that it's really normal that people would have their sleep disrupted. But what we really want to address in these sorts of interventions is where people then try to have solutions to that sleep disruption that actually keep the problem going much longer than it needs to, or whether there are beliefs and thoughts that come in that keep the problem going a lot longer than it needs to. A lot of the time, sleep issues, if you don't have these sorts of perpetuating things put in place, they just resolve themselves over time. And we were sort of talking before about how if you stop someone from having a good night's sleep for a while, their body will automatically compensate. And usually, within a matter of 2 or 3 nights, their body has fully compensated for the lack of deep sleep. What we're really trying to do is get rid of the barriers that stop people from just having their sleep resolve naturally. And so this is an example of one of these sorts of things that people might put in place that feel like solutions, but really it's keeping the problem going. You can see one of these things is either napping in the day, and the other thing is that I would add to this is overthinking about sleep being lack of sleep being a really big problem. Both of those things often start a vicious cycle where the insomnia sort of is actually encouraged, it's not reduced. Anyone want to chime in with a question or a comment at this point? This probably feels familiar to a few people, this sort of cycle. So there are lots of different things we can do to help with nighttime sleep problems. Medications are often the first go-to option, which is not an unreasonable thing. A lot of the time people just need a bit of relief and do need some sleep, and medications can be helpful for that. CBT though, cognitive behavioural therapy, is most often than not going to be the most helpful treatment for insomnia. It corrects issues that has a much longer term benefit, and also doesn't have the same side effects that medications can. And basically what CBT is doing is just looking at our thoughts, our feelings and our behaviours, and how each of those things might be negatively impacting our sleep, and looking at ways we might adjust one or two or all three of those different areas. I find CBT really useful because it gives you lots of different ways of looking at changing things up. And for some people, they might immediately sort of recognise, oh yeah, look, I'm overthinking, I think that's the problem. For other people, they go, no, I don't really notice myself worrying a lot, but my body is just wound up. And other people might say, well, oh yeah, look, I actually, my sleep schedule's all over the place. So I like CBT because it gives you a lot of flexibility with looking at where the issue is, and just being able to sort of focus in on what you need. And so if you looked in that self-help booklet that I talked about at the beginning, you'll find all these different suggestions about how you might improve sleep with thoughts, feelings or behaviours. And I'm going to go through a whole bunch of them now as well. And look, this slide's probably a bit misleading in saying address each one of them. Consider each of them. And what I find is that usually people will be drawn to maybe 2 or 3 different things that really seem to stand out as going against what we know is helpful, and that they could make a change to 2 or 3 different things. It's really helpful to keep a diary about your sleep to see if the changes that you put in place are actually helpful or not. And usually you want to do it over about 2 to 3 weeks. What we find is that changing your sleep through these CBT methods does take at least a couple of weeks to sort of really just notice sleep improving consistently. But that once those changes are achieved with a CBT approach, then they seem to be fairly stable. Here we go, 4 to 6 weeks of dedicated change seem to make it work. I'd say the bare minimum is probably at least 2 weeks of, if you decide to use one of these strategies, keep a bit of a diary of how your sleep is each morning. You just write down what you thought the quality of sleep was, and what you'd done the day before to try to help it along. And just over time, you get a sense of whether things are making a difference. So we've got these first line of things to consider, and we want to consider these medically if we can. So a lot of the time, when I speak to people who have some of these physical issues that are stopping them from going to sleep, they can be resolved medically without like sleep medicine, but just something that will actually alleviate some of these side effects. Like maybe the medication that they're on, there's an alternative that doesn't actually cause as extreme these side effects as the one they're on, or maybe there is a different pain medication that someone could take that's going to really reduce the intensity of pain. So this slide, I suppose, a lot of the time is just to prompt people to, if they're having problems that are disrupting their sleep, to raise them in consultations with their doctors, and really see if there are any medical solutions to some of the things that are disrupting sleep. That's something that I would sort of want people to have checked off before they try all of this CBT stuff, in case there's a much easier solution. Once you've asked for those sorts of things from a medical professional, then you might start getting pretty creative with your own solutions to these problems. So we talked a bit about hot flushes before, and as I said, a lot of the time this is preparation. It's really recognizing that this is a nightly issue and preparing for it as best you can. A lot of people find, as I said, they need changes of pajamas or changes of clothes, changes of bedding that's sort of pre-ready for them to use if they need it. Urinary problems are a big disruptor for a lot of people at night time, and if they need to get up and go to the toilet, that can really be disruptive, because people wake up a lot more fully than they would if they could just sort of wake up and then roll over and go back to sleep. So some of the things there might be medical solutions if people need to use pads and that sort of thing, or it might be that they have a nightlight on in the hallway, so that they can get up and go to the toilet without flicking all the big bright lights on, and without sort of any of the upheavals that might come along with getting up and going to the toilet. Pain is bowel problems. So, say the solutions are similar. Really want to be speaking to your doctor about those, and then if they are not resolvable medically, then trying to come up with as many creative solutions as you can to prepare for them at night time. Now, pain is a really difficult challenge for sleep, and I think that from my experience, once the medical solutions have been exhausted and pain is still there at night time, the most helpful things that I've seen people use are physical relaxation exercises, and we'll go over a few of those soon. Dry mouth as well, really important for people to sort of prepare for that, to have water or different liquids next to their bed that they can just sip on. So a lot of these cancer-specific factors are going to mean that people need to be a lot more prepared for their nighttime sleep than they otherwise would have been before cancer. There are two different things that really help in terms of managing nighttime worrying. So the first thing is that you learn to do things that slow down your thinking in the evening. One of the things that I often hear from people is that they get distressed by their worries at night time. And one of the things that they will do to solve that is distract themselves with a movie or with watching sports, or some exciting TV show or something like that. And it's actually what they're choosing to distract themselves with is really mentally stimulating. And so as soon as they turn off whatever they've been using to distract themselves from the worrying, their mind is still extremely active and it will just go back to what it was doing before. It's still got a lot of momentum. And so one of the things that people need to start doing often to combat nighttime worrying is to do activities in the night that really do slow down the brain and the mental activity. It might mean finding some things on TV or some books that you can engage with that are quite boring and being willing to persevere with those until you find yourself tired again. So one of the approaches is to recognize what you're doing in the evening to slow down thinking. The other approach is that what the research shows is that if you can actually spend a bit of time with worrying thoughts during the day, it actually decreases the amount of worry that people have in the evening. And in CBT, we call this worry time. It's a sort of a strange approach if you're not used to seeing it, but the research shows and my experience shows it really helps. What this tends to look like is setting aside 10 to 15 minutes in the day, get out a piece of paper and write down what you're worrying about. It doesn't have to go into a lot of detail. It's just dot points. And the more that you can bring out, the better. And then things that you can actually address, it's really helpful to just write down what you think the next step you need to take is that will help to solve that thing that you're worried about. For example, if something that you're worrying about is whether is a side effect of the treatment that you're on and whether it's likely to be resolved, then you might write down, next appointment, I'm going to ask the doctor about this. Or if one of the things you're worried about is the well-being of somebody in your family or a friend or something, you might say, my next thing is tomorrow I'm going to send them a text message. So you have like one action that you're going to take to resolve it. And then other worries, there won't be any solutions to take, but you just sort of recognize that. And this practice does a couple of things. One is it stops people feeling like they need to avoid worrying. And it means that when worries come up, they're actually not as intimidated or stressed out by them. In other words, you kind of train yourself to have worries rolling around and it doesn't actually impact you physically. It doesn't wind you up as much. The other thing it does is it trains you to be able to stop the process. So if you do it for 10, 15 minutes, and then at the end of that, just close the book and do something else, you're training yourself to be able to just stop worrying. Start worrying and stop worrying. And the other thing that it does is it means that at night time, when worries come up, you can quite easily say to yourself, oh yeah, that one came up today as well. I remember there wasn't really anything I needed to do about that one. Or if it comes up at night, you can go, oh yeah, that's right. I thought about that today and I decided I was going to do this thing. I'll do that tomorrow. So you have something actually pre-planned that you can sort of respond within yourself to the worrying. I really recommend this approach. I think it's extremely helpful. When you start having unhelpful thoughts about sleep, or beliefs that you're saying to yourself about sleep that are really worrying. This is one of the most common spirals that I see people get caught up in. And it's really important to have some responses to yourself if you're really worried about the impact of having a night of no sleep. These are true statements. Peaceful rest is as good as sleep. Sleep problems are normal. It's okay if I don't get to sleep straight away. Worst thing is that I'll be tired and grumpy. It's not the end of the world. This won't last forever. These sorts of things are extremely helpful. They might seem a bit, basic here and now at, what is it? At 10 to 3, but at 3 a.m. they make a big difference. Now, reducing stress and low mood will also help with sleep. If these approaches that I've just laid out don't seem to help, then I would really consider getting some extra support from a psychologist like me, or just seeing a GP and asking their advice of who you might see. Now, the other approach is the stressful feelings that people get, and a lot of these are helped with exercises that calm the mind and the body. Breathing exercises are extremely useful for this, and progressive muscle relaxation are extremely helpful, particularly for pain. So, progressive muscle relaxation is something that I would recommend to most people who have pain at night time. And you could type these things into Google or YouTube and get some nice guided meditations that will teach you these techniques. But in a nutshell, deep breathing means just that you're regulating your breath into your belly rather than your chest. So that you're breathing into your belly, and that you regulate it. So, 5 seconds in, 5 seconds out. Doing that for 1 minute has a really, often a really profound impact on the physical arousal that people are experiencing, and helps them get ready for moving, into that first and second phases of sleep. Progressive muscle relaxation is one for that tossing and turning problem we talked about before. It often really reduces the intensity of pain. And so this is where you're going through your body and tensing up all the different muscle groups for about 10 seconds, and then releasing and relaxing them for about 10 seconds. If you type that into Google, you'll be able to find some guides for going through these processes. And then the behavioral strategies, just really quickly, these are the ones that we talked about before. And so a lot of these are about establishing a really good sleep routine, and
Oliver, you're frozen on my screen.
Oliver, are you still there?
Are you there, Danny? Hey, are you live?
I can't hear Oliver either.
Oh, I